Hello friends, myself Arpan Pranchal from intern batch. Today I am going to explain you about the technique of giving an intramuscular injection. For intramuscular injection, we are daily giving in our emergencies and OPDs on a day-to-day basis. It is a very easy method to give an injection, and we can give it very immediately to any patient. For intramuscular injection, we first need a drug. The drugs came in two containers. Either it comes in a vial or it comes in an ampule. In an ampule, the drug which is given is we give in a single dose. If we open the ampule, we have to give the full dose at that time. In the ampule, the drug forms come in two different liquid forms. Either it come in a clear form like gentamicin, either it come in a liquid suspension like testosterone, or either it come in a oily form, that is anabolic steroids that we give. Now the second important step is the syringe selection. The syringe nowadays we use that are plastic syringes that are disposable, that these are used only once for giving an injection. Thus, for the syringe, the different sizes are available: 2 ml, 5 ml, 10 ml, 20 ml, and so on. Syringe that can accommodate double the volume of the required dose is used for giving an intramuscular injection. For intramuscular injection, the needle size is generally used from 20 gauge to 24 gauge. The size of the needle is around 1 to 1.5 inches, because we are giving the intramuscular injection in the deep layer of the muscles, so that needle should reach that muscle. Now I am going to explain you how to aspirate from the ampule. Nowadays the ampule that are cut, on this there is a marking given that is called thumb rest, blue colored dot, and on the neck of the ampule there is a one scratch like small dot mark is given, that is called 1 point cut. Now I will explain how to aspirate from the ampule. First, wash your hand before aspirating from the ampule. Then take the ampule, flicker it from up so the volume, the liquid from the neck will go down. Then take a needle, remove the needle cap. Then to break the ampule, first put your thumb on this blue dot, that is called the thumb rest. Hold it in upright position, give a gentle pressure and break it. Now the ampule is broken. Now directly put the needle inside the ampule and aspirate, tilt it like this and aspirate the drug required from this. Now remove the air bubble from the syringe. Now I will explain you about the sites of giving an intramuscular injection. There are mainly 3 sites in the body where we give an intramuscular injection. First is the deltoid muscles on the arm. We give an intramuscular injection on the deltoid when there is a small amount of dose of the drug, like 2 or 3 ml is required to give it, or the majority of the vaccines which are giving an intramuscular dip that we give on the deltoid side. Due to high chances of the injury to the neurovascular bundles below the deltoid muscle, we don't prefer to give high doses of the drugs to that area. Now the other side in the body where we give the intramuscular injection is a vastus lateralis muscle on the thigh, on the lateral side of the thigh, that we generally use in the children for giving an intramuscular injection. The site also can be used to give intramuscular injection, to self-administer an intramuscular injection in the adults. Now the major site that we used for intramuscular injection is a gluteus maximus, that means on our buttocks. Now on the buttocks, now I will explain you in the detail on giving the intramuscular injection in the gluteus maximus muscle. on the gluteus maximus, while we giving the injection, first we divide the gluteus maximus in the 4 quadrants by drawing one perpendicular and one horizontal line. Mostly we use the upper and outer quadrant of the gluteus maximus to give an injection. That is a very safe site for giving an injection because of the very less chance of injury to neurovascular bundle. Now, put your palm on the hip of that person. Then your finger should point toward the head of that person. Now, place the fingers like that your thumb should face toward the groin of that person. Your little finger feel the pelvis, and then your index finger and middle finger separate them, make a V shape, and now give an intramuscular injection in the middle of that V. Now we have to give an intramuscular injection at the 90-degree angle. The whole needle should go inside around 1 to 1.5 inches to reach the muscle. Then aspirate little amount so that we come to know that either this is in a muscle or in a blood vessel. If the blood comes, then remove the needle out and insert again. If there is no blood is coming, that it is in a muscle, then give the full dose of drug in the muscle, wait for 5 seconds, and then remove the needle. Don't massage the area of giving an injection, because while we massage the area, the drug which is in the muscle will come out in the subcutaneous area. Okay, so don't massage that area. Nowadays we use a Z-track technique for giving an intramuscular injection. In the Z-track technique, before giving an intramuscular injection, we stretch the skin of the person, and then we insert the needle at the 90-degree angle. Then we push the dose and remove it, and then release the skin. So by doing this, there is a Z-way type of the track is created, so that the drug which is injected intramuscularly, that doesn't spill out in the subcutaneous area. So to prevent the spillage of the drug, we use the Z-track technique.